Hi everybody, welcome back to another episode of Dr. Bader Knows Hollywood. Today we're going to be analyzing Paris Hilton's nose. Paris Hilton, everybody remembers from her early 2000s reality TV show. She was really in the spotlight, had a lot of photographs taken of her. Well, recently she's been back in the news, and it's given me a chance to look at her nose and analyze some things. There's some things that I like about the nose. There are a few things that I really don't like about it, and I think Paris knows that her nose isn't the greatest either, because she does this one really weird trick to hide her poor angles whenever she's having pictures taken of her. So I'm going to show you what she does. You might be able to learn something from her. And of course, I'll show you what I would do to make her nose a little bit better. We'll do some computer morphing, and I could show you all what Paris's nose could look like if she had a rhinoplasty. So come along. I think you'll enjoy it. We'll see you in a minute. So Paris Hilton, obviously being a public figure for many years, has had a lot of photographs. Let's start with her profile, actually, and I'll point out a few things that I actually really like. She's got a very nice radix. The radix is where the nose starts, right between the eyes, and for a female, it ought to be right at the level of the eyelashes or so. So she's got a very good starting point for her nose. I will say that overall her nose is a little bit long relative to other facial features. She still has a little bit of a bump on her dorsum, which I'd like to get rid of. In addition, there's not much of a super tip break. Again, we like the tip to be above the bridge line, and that creates that really pretty feminine profile that we're all used to seeing. In addition, I think her tip's a little bit rounded, so I would like to define the tip a little more to create more of a feminine profile. When we look at the nostril axis, so the line that the nostrils makes, the tip really ought to be along this line, and anything below that is infratip, and we don't want too much volume here. That creates a less attractive nose overall, and you can see that Paris has quite a bit of tissue below her tip, what we call a hanging columella or a hanging infratip lobule. It's not very attractive, so I'd like to fix that. I really think that her projection is very good. So the projection is how far does the nose come off of the face, and I think that's very appropriate. I don't think she needs to be deep projected at all. The numbers all line up, and she's got really good balance here. So let's go ahead and look at the morph. Of course, first of all, what I'm going to do is push this bump down to create a nice straight profile. In addition, we really need to focus on the tip. In addition to rotating the tip and lifting the tip above the bridge line, we want to get rid of that infratip lobule that I was showing you. You can see that that really creates a much more feminine, softer appearance with a shorter nose overall, and it's quite a big change for Paris. When you look at the two side by side, you might say, well, that's too much of a change because her nose really is a defining feature, but this is kind of what I'd like to do to rotate her tip and shorten her nose, because I think overall that creates a better appearance for her particular facial features. But the patient might have different ideas, and that's all part of the process. So switching to the frontal view, you'll notice right away that she's got a bit of a crooked nose. The nose bones deviate to the right, and then the nose kind of leans back to the left, which creates a curvature here, which is a bit distracting. In addition, when you look at the tip of her nose, the light reflection on the tip of her nose is very circular, and it's almost pinpoint here. We want to see that light reflection spread out a bit. Again, a horizontal elliptical shape of the light reflection of the tip is really what's going to be attractive. The length of her nose, I think, is an issue as well. A nose that's too long is not always attractive, especially on a woman, and a lot of this excess length comes from the infratip lobule. Here, this blue line represents the nasal nostril axis, and the tip ought to be at this line, and everything below this line is infratip lobule or hanging columella, and it's not an attractive feature at all. With rhinoplasty, we really don't want very much tissue at all below this axis line, because it's not attractive, it's not feminine. So I'd really like to see that corrected, which will help shorten the nose quite a bit. So let's switch over to the morph. Right away, we want to straighten the nose by moving the nose bones back to the middle. In addition, we want to correct this hanging infratip lobule. Again, not attractive, and lifting this will help create a more feminine shape and a shorter nose. We're going to narrow the tip cartilages quite a bit. In addition, we want to widen the tip some so we have a better light reflection off of the tip of the nose. And overall, you can see that that creates a nose that is straighter, it's shorter, but it's also more feminine. And when you compare the two side by side, you can see that her nose is sort of long and crooked, and it's really a defining feature for her. So she might not want such a dramatic change, but I think this is a really nice nose on her for sure. I think Paris is aware that she doesn't have the most aesthetically pleasing nose. It's probably one of the reasons that she always turns her head in photographs. She's very careful to always present a diagonal view to the camera, not a profile or straight-on view, which can accentuate some of the more unattractive features of her nose. Seems to work for her, and this pose is kind of what she's known for. It's her signature pose. It's in part to camouflage her nose. Okay, well, I hope everyone enjoyed that. That's my analysis of Paris Hilton's nose. Let me know if you have any questions, drop a comment below, and we'd really like to hear from you about who should we do next? Which Hollywood nose would you like for me to analyze? Let us know, and we'll see you again soon for another episode.